Primary care is failing and both patients and healthcare providers are paying the price. I'm Candace, a family nurse practitioner who still loves primary care. I teach primary care providers how to keep their work from consuming their lives inside a system that often feels like it's collapsing. Let's be honest about what's happening. Patients wait weeks for primary care appointments and months for specialty appointments. Schedules are jam-packed to account for no-shows and walk-ins, and all visits are rushed. Problems stack up faster than they can be addressed, and medical providers are told implicitly or explicitly, just see more patients, answer more messages, figure it out. In many clinics, volume isn't capped, inbox work is infinite, new responsibilities are added without removing old ones. So the system leaks, and that leak lands on you in the form of nights spent charting, weekends clearing inbox messages, and moral distress when care feels rushed or incomplete. This isn't because medical providers don't care. It's because the system offloads its failures onto individual providers. Here's the part that matters. Primary care is failing structurally, but the consequences are absorbed personally. The system doesn't explode, it just quietly asks medical providers to compensate. One more patient, one more message, one more task. And because medical providers care deeply about their patients, the work gets done, unpaid. So what do you do in a failing system short of quitting? Here are 3 concrete actions that actually matter. Number 1, stop silently compensating. If work routinely spills into unpaid time, you need to name it. First to yourself. Track it. How many hours of work outside of scheduled time are you actually doing? And what type of work is it? Is it results? Is it charting? Is it portal messages? Is it returning phone calls? Unseen work is easily dismissed. Documented work is harder to ignore. So you need to be keeping track of what unpaid work you're doing outside of business hours. Number 2, force those trade-offs into the open. When something new is being added, ask out loud, what is being taken away from my everyday responsibilities in order to make room for this new thing you're asking me to do? And if the answer is nothing, then the expectation is unpaid labor. That's not a misunderstanding. That's a choice. Number 3, contain what you can control. You may not control the amount of visits that you're doing, but you can control how many problems you address during a visit, how you communicate results, and what issues require a visit versus a message. Containing the breadth and the scope of your workload doesn't fix the problem, but it prevents the system from consuming you completely. This isn't about pretending that all is fine in primary care. It's about refusing to let a system, a failing system, greedily take your weekends and your evenings and eventually your health while you quietly power through it. You can acknowledge the failure and still protect yourself within this failing system. If you're trying to practice good patient care without sacrificing your life, start with my free NP Workflow Survival Guide. It lays out practical ways to contain the work when the system won't. Check my channel description.